In this video, we'll be discussing step therapy and its impact on patients. Step therapy refers to a situation when the physician prescribes one drug and the health plan requires the patient to try a less expensive drug first, in effect, overruling the treating physician. Only after the drug fails to help the patient will the plan cover the drug that was initially prescribed. Patients can be required to try multiple cheaper drugs in a process that takes weeks, months, or even longer. That's why this policy is also sometimes called fail-first therapy. Because the patient must take one or a series of medications that fail, they may face harmful delays in receiving effective care. For cancer patients, step therapy can also cause a reduction in the effectiveness of a prescribed treatment plan, as the precise timing for taking these drugs can be important. In the following story, you'll learn how the unintended consequences of step therapy affected a patient.
When I was 28 years old, I'm doing my morning routine. I walked into the bathroom, ready to brush my teeth, and I just dropped to the floor. I passed out. And I went to my primary care physician, and he noticed a high increase in the CK levels in my blood. He referred me to a rheumatologist, and the rheumatologist knew right off the bat that I had polymyositis. He knew the drug rituximab would be my silver bullet, but he knew that from previous patients that he would have to take me through the process of step therapy. As part of the step therapy process, my doctor prescribed high doses of prednisone. He prescribed other drugs to help with the prednisone so that, my organs didn't have any organ failure. About 8 pills a day. Taking all that medication daily, I would be tired. I couldn't focus on things, blurred vision. My fingers would get numb and turn white. I would develop rashes, bad acne. I was constantly irritable. For someone going through a chronic disease, you're already in a hell. And when you add step therapy on top of that disease, it just puts you further in. And it's almost a slap in the face to someone who's paying for insurance.
The key takeaway is that while insurers use step therapy as a cost-saving tool, it can increase out-of-pocket expenses for patients and create delays in care that can prolong treatment and lead to worse outcomes. Don't allow step therapy to be included in your prescription coverage plans. If that's not possible, adopt limits such as those in the Safe Step Act. They will protect patients who are most likely to suffer significant harm from taking medications other than what their doctor has prescribed. To learn more about how utilization management can affect patients, please refer to the booklet Best Practices for Prescription Drug Benefit Design, available at cancercare.org, and view the other videos in this series.